is Cable Channel 5, your local origination station serving the greater hub area.
Good evening, and welcome to another edition of the Yuba City Medical Explorer. My name is Dr. Robert Peppercorn, and my specialties are dermatology and allergy. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices right here in our local area. Tonight marks a new milestone in the production of the Medical Explorer programs as we begin our third season of broadcasts. Through the outstanding cooperation of the dedicated and hard-working staff members of NorCal Cable Channel 5 and NorCal Cablevision, we've brought you more than 42 individual half-hour, locally produced Medical Explorer programs during the past 2 years. I must also thank you, my dedicated viewers from the Yuba Sutter area, for your many words of encouragement and helpful ideas that you've sent me. Please keep those excellent letters coming in, and please continue to join us every Tuesday and Friday here on Cable Channel 5. We bring you another interesting program tonight, and a first for local origination programming in this area. In a few moments, our Medical Explorer Channel 5 cameras will take us behind the closed doors of the operating rooms of the Fremont Medical Center in Yuba City, where we will witness an actual childbirth. We will watch a special type of childbirth called a Caesarian section delivery, performed by one of our area's most highly skilled specialists in obstetrics and gynecology. Before getting to this fascinating topic tonight, let's take a look at the latest medical news. My first medical news story concerns a possible new treatment for corns. Collagen, a fibrous protein used by doctors to remove wrinkles and body scars, restore vocal cords, and strengthen weak knees, is now being studied for its ability to prevent corns on the feet. Researchers at the Collagen Corporation in Palo Alto have developed a form of collagen that, when injected into the feet, builds a pad that protects against the stress that causes corns to develop. These corn cushions may prevent new corns from developing. Corns, which develop between the toes and on the sides of the feet, are skin growths that thicken as a result of pressure or friction caused by tight shoes. Sometimes painful, they may require trimming by a doctor or surgery. Intended as a simple annual office procedure, the new collagen injections are now being studied. My final medical news story tonight concerns a hepatitis vaccine. Fears that hepatitis B vaccine may transmit AIDS disease are unfounded. Doctors said recently, adding that homosexuals vaccinated against hepatitis may be less likely to contract acquired immune deficiency syndrome. Researchers at the Massachusetts General Hospital, who tested people who received the vaccine, say they could find no cases of AIDS in people who were vaccinated against hepatitis that could not be attributed to other sources of infection. Speculation that hepatitis vaccine might transmit AIDS developed when it was realized that some of the blood used to make the vaccine is obtained from homosexual men. The vaccine is made from the blood of people with hepatitis, and homosexuals are more likely to have hepatitis than heterosexuals. My health tip tonight concerns a very unpopular, often sexually transmitted disease called herpes. Herpes simplex is a contagious viral infection contracted by close contact with people with active lesions. It is unique in its ability to recur repeatedly. After individual infection, the herpes virus may lie dormant throughout the individual's lifetime, but the infection may flare up spontaneously or following fever, illness, sunburn, injury, or stress. Herpes simplex appears most often on the lips, genitalia, and buttocks. Attacks usually occur in 3 phases: pain, tingling, or itching in the affected area 2 to 24 hours before the onset of the attack. This is called the prodrome: redness, swelling, and development of tiny blisters. The blisters dry and the scabs form. When the scabs are shed, new skin forms and the attack is over. Attacks range in length from 2 to 10 days. Frequency and duration of flare-ups cannot be predicted. Herpes simplex is contagious during its blistering stage, but skin contact should be avoided until scabs are shed and new skin appears. When active lesions are present, dermatologists recommend that individuals avoid sexual relations, kissing, and sharing of towels and eating utensils. Pregnant women with herpes simplex, or those who suspect they have been exposed to the virus, should alert their obstetrics and gynecology physician. Tests are available to detect the infection, and precautions can be taken during delivery to ensure that the infant is not affected. Currently, there's no known cure for herpes. However, a new medication called acyclovir may shorten attacks and decrease viral shedding if used during the initial attack. A dermatologist can provide more information and assistance in controlling herpes flare-ups. Now, on with the Medical Explorer. Before we head over to Fremont Operating Room tonight to watch our actual childbirth, I'd like to introduce you to our special guest, Dr. Damon Stutes, one of our area's most highly skilled and respected specialists in gynecology and obstetrics. Dr. Stutes, welcome to the Medical Explorer, and thanks for taking time out to come over today.
Thank you, Bob. Pleasure to be here.
Thank you. Would you begin by telling our viewers where you're from and where you received your education and training in obstetrics?
Certainly. I was born in Lansing, Michigan, and spent all of my years in high school and college there, and then I went on to Michigan State University where I did my medical school training. And upon graduation, I moved out to California to Sacramento and did my specialty training at the Kaiser.
The residency of your
Yes,
training.
the residency at Kaiser in Sacramento.
How many years were you there before coming out here?
4 years at
4
Kaiser.
years. So you go through 4 years of college, 4 years of medical school, and then 4 more years of residency training to become a gynecologist and obstetrics specialist. Is that correct?
That's the usual way. I actually only spent 3 years in college. I kind of got lucky.
Okay, well, but we ought to let people know what the usual standard is for that, too. I'd like you to explain to our viewers who aren't aware of the way deliveries are done, the difference between a vaginal delivery and a Caesarian section delivery.
Well, the usual route for delivery is through the vagina, and there are several things that take place late in pregnancy that allow a fairly large item like a baby to come through. The bones are loosened in their attachments, and the muscles and the tissues of the pelvis and the vagina dilate and stretch to allow the baby to come through. In some cases, that is not a possibility. Some women that are extremely short have deformed pelvises, or that have babies that are too large.
They just won't fit through the vaginal canal.
Exactly, exactly. And so we have to find another way out.
How do you know if a baby is too big to get through? How can you tell that?
Well, unfortunately, most of the time we have to determine that by watching what happens during labor. When labor starts, the cervix, which is the lowest protrusion of the uterus that is in the vagina, starts to open. And the process of going from being completely closed to completely open to allow a baby to go through can range anywhere from an hour, which is extremely short, to 24 hours, which is on the long side.
So that's considered the time of labor?
Labor, yes.
Okay.
And some of the dilation or the opening of the cervix can occur before the actual hard labor starts. And the usual picture for a woman having her first child is that the cervix is already dilated or open about 2 centimeters, which is just about an inch.
Are you there watching the patient during this entire labor process, checking the patient over? Is that how it works out?
Most of the time, the checks here at Fremont Hospital are done by the nurses. When the physician is there, we frequently do the examinations. During the early phases of labor, it's customary for the physicians to be near the hospital, although not always in the hospital. But at a moment's notice, we can find our way here.
Get ready and get going.
Yeah.
What are some other reasons that a woman would need a cesarean section rather than a normal vaginal delivery?
Well, one of the unfortunate things is the herpes virus that you just mentioned. That occurs about 1 time in 100 women that are delivering babies. The average on a nationwide basis is that 10 women out of 100 won't deliver vaginally and will need a cesarean. The largest of those reasons is that the baby just isn't going to fit. Another large category is breech babies, or babies that come bottom first. And the problem with those babies is that the head is the largest part, and when the bottom comes through, the head may not fit. And about 7 out of 100 babies that are coming through the birth canal or the vagina breech won't make it without some serious injury. And so it's customary to tell the women about the dangers of a vaginal delivery, and most of the time we do a cesarean for breech babies. And one other large category is what we call fetal distress. We listen to the baby's heartbeats during labor, and we also have special monitoring devices in the labor room, and we can tell if a baby is having some severe difficulties. And it can be from anything as simple as the cord being wrapped around the neck to actually being some internal bleeding.
So you don't want to take the time to let the baby stay there if there's the possible thing that the baby's under distress, the heart's not beating properly, something's going on, oxygen isn't getting there properly.
Exactly.
And that's when you might want to rush in and do the cesarean section.
That's a real exciting time for us.
Right. Very important time, and that's where your specialty training of those 4 years really comes into play, right at that time. I've seen that. It
certainly does.
Why did the patient that we're going to see tonight have to have a cesarean section?
Well, this was her second baby. The first baby, she was in labor for a number of hours, and the cervix didn't open up, and it became apparent that baby wasn't going to fit through her pelvis. And rather than subject her to another labor, it is customary to do a repeat cesarean section. Although it's not always necessary.
I was curious about that. If someone has a scar on the uterus after a cesarean section, does that mean they always have to have another one?
Well, it used to be. Now, though, it's become apparent that it's not absolutely necessary. In 1978, when I was in my residency at Kaiser, myself and some fellow residents had some patients that wanted to deliver vaginally after having cesareans for, say, a breech. And when their labors went normally, we allowed them to deliver vaginally, and it became customary throughout the nation to allow women to attempt that, and there's some real good success.
Well, we've reached that time we've been waiting for. Let's leave our studio now and explore behind the closed doors of the operating rooms at the Fremont Medical Center.